Welcome, everyone, and thank you for joining us for lunchtime. We're so happy that you're here to hear about the dashboard. And I'm Elisa Dresba. I'm the Director of Research and Community Impact at the New Hampshire Children's Health Foundation. This presentation will cover the history and the purpose of the Children's Health Dashboard. Then we will walk through the website and highlight its features. We will answer questions at the end, but you can type them into chat at any time, or you can wait and raise your hand at the end. To kick us off, let's begin with the Foundation's president, Gail Garceau.
Thanks, Elisa. Good afternoon, everyone, and thanks for coming today. In 2022, the Foundation Board of Directors undertook strategic planning to align its efforts with key community needs. Among their priorities was the creation of a resource to deliver meaningful insights to both the community and the Foundation itself. This resource took shape as a children's health dashboard designed to focus on key determinants of children's health from birth to age 17, as well as the policy levers that influence those determinants. While New Hampshire performs well on many national level measures of children's health, the board recognized that statewide averages often mask disparities. Not all children and families experience the same opportunities or access to resources. To address this, the dashboard was designed to provide more detailed insights by utilizing data from public health regions rather than relying solely on state-level statistics. All data included in the dashboard was selected for its availability and relevance to these regional geographies. A great deal of time and energy has gone into the development of the Children's Health Dashboard, and we hope this tool will be both helpful and useful in your work in the days ahead. I'm now pleased to turn it back over to Elisa, the creator of the dashboard, who will guide you through its features and capabilities. Elisa, you're on mute.
Thank you.
Welcome.
Fifth time's a charm on these webinars. So this is the homepage for the dashboard. And that URL that you see is live. We'll also put it into the chat for you, and there'll be a slide at the end, so feel free to visit at any time. It is officially launched in public. The purpose of the Children's Health Dashboard is to help people gain an understanding of the top conditions that drive children's health. In New Hampshire, the dashboard looks behind statistics to understand how external factors like neighborhood safety or socioeconomic status affect children's health and well-being. The dashboard was modeled after the Health of the States, which is a national project that looks at associations between state health outcomes and potential health determinants. Our analysis involved examining associations between health behaviors and outcome measures and health determinants at a New Hampshire public health region level. By focusing on the top 16 interconnected conditions, we give a clearer picture of what shapes the lives of children and families. Following a what, so what, now what framework, we take you through the story behind the numbers. What, to identify the key issues, so what, to explain the key issues, and now what, to provide strategies to impact the key issues. We conducted focus groups with the first version of this dashboard website and heard from people that they feel it would be useful for applying for grants, for use in landscape analyses, useful to school districts, and also for advocacy. I'm going to scroll down now and show you those top 16 conditions. These are the conditions that the dashboard focuses on. The dashboard project started with an analysis of health outcomes and conditions looking for those whose scores showed that they were correlated with each other. Of the 22 conditions we used in our analysis, these 16 had the strongest correlations with health outcomes and behaviors in New Hampshire. The conditions highlighted here present an opportunity to come together to advance the health and well-being of children through policies and programs that could, over time, improve them. The conditions are listed in order of how strong a correlation they had with the health outcomes and behaviors. They are also color-coded according to the domains: economic, education, family and built environment, healthcare systems, and safety. Before we dig into the conditions, I just want to show you the rest of the homepage. As Gail mentioned, we wanted to do a more granular than state level analysis, and so we selected public health regions as our geography. We also recognize that not everyone is familiar with public health regions. So we provided a geography section that lists each of the public health regions. And then there's a map over to the right side that has each of them labeled. And then if you scroll over, they each show you the towns contained within the regions. And so that works all the way across the state. Anytime you want to get to the top of the homepage or you want to return to the homepage, you can click on either our logo or the words Children's Health Dashboard, and it takes you right back up to the top of the homepage. The dashboard is not just for subject matter experts and has been designed to be accessible and easily understood by a wide audience. It is also not a substitute for community-level conversations, which are critical for assessing the qualitative information to complement this quantitative base. Finally, the foundation is not telling people what to do, but instead creating a starting point for opportunity and exploration. So now we'll dive into the conditions pages. As well as being clickable down here where I showed you, you can also go up here to the menu, conditions associated with children's health. Once again, they're listed in order, and we're going to begin with number 2, bullied at school. All of the conditions pages follow the same format. They always start at the top with the condition and the domain, in this case, safety, the number that it's ranked at, and the name of the condition, bullied at school. And then when you scroll down, you will see a map organized by public health region. And when you hover over that map, you'll see the public health region names and the rates. So for example, for bullied at school in the North Country region, 25.9. Down below, there's a legend that explains the lowest percentage for this condition and the highest percentage. So this ranges from 17.5 to 25.9. On this particular condition, there are also portions of the map here along the seacoast and the border of Massachusetts that are white. The legend tells you that they are white because the data was not available for this region. We also provide a link back to that geography reference map in case you have not fully memorized the public health regions at this time. You just click on that map, it pops open again. Once again, you can scroll over it to see the towns, and then you can press the X in the corner and it disappears. Over on the right side, we have the definition of the condition. So in this case, bullied at school means 9th through 12th graders who report that they were bullied on school property during the past 12 months. Bullied at school is considered as a risk factor, and we spell that out here, and we also highlight it in red. And then we let you know that a higher percentage of this condition is less desirable. We also provide you with the statewide rate, which in this case is 20%. And then we list the top 3 regions as far as highest rate. Once again, a higher percentage is less desirable. So we have the North Country, Carroll County, and Central New Hampshire. Below, we share with you the data source, which for this is from the Centers for Disease Control and Prevention. This is the Youth Risk Behavior Surveillance data, which is self-reported data that comes directly from high school students in New Hampshire, as opposed to some bullying data that you may have seen, which is school reported. They have different definitions, different tools to collect that data. We also provide a link to the data set. If you right-click on this map, you can save or copy the image and use it for whatever you would like to do with that. And of course, at any time, you can do a screenshot and use these visualizations in any presentations you might have. Now we'll scroll down to the so what section. This always contains an explanation of the issue so that people can understand how it relates to children's health. So for this case, we explain that bullying causes physical and emotional harm, and some children who are bullied find it hard to sleep, do well in school, or even want to go to school at all. There are also negative effects on the child that is doing the bullying. Right below that, you will see the types of health outcomes and behaviors that are associated with this condition. So in this case, bullied at school is associated with all 4 domains of health outcomes and behaviors: smoking, drugs, and alcohol, safety, physical and mental health, pregnancy and birth outcomes. During one of our feedback focus groups, we had a request that we add the ability for people to quickly look at each of those domains and see the conditions associated with that. So we did create that page, and you can access it by clicking on this associations button, and it takes you to that page. Here you see all 4 domains for health, behaviors, and outcomes, and all of the conditions that are associated with it. So if we scroll down here to physical and mental health, you can see the condition we were looking at, bullied at school, 67%. What does 67% mean? Well, it means that of the data indicators underneath the domain for physical and mental health, bullied at school was associated with 67% of those indicators. Now we'll go back and we'll finish going through the condition page. The next section is the now what section. This is where we've provided evidence-based strategies, policies, or investments and interventions that can impact this issue. Each of these tiles is clickable and it takes you directly out to the resource. And we have included interventions at both an upstream and midstream level. And there's a whole array of this. For example, this one under bullied at school not only contains some violence prevention resources, but it also includes some resources, for example, around lead prevention. Research shows that exposure to lead in childhood can lead to aggressive behavior and violence later in childhood and later in adulthood. If you scroll down past all of the now what resources, you get to this section down here. There's a tell us, a dig deeper, and a share this data. We're going to go over the tell us and dig deeper when I cover the rest of the menu a little bit later in this presentation, and then share this data as sort of your standard social media. Down here, if you want to receive updates about the dashboard and the work of the Children's Health Foundation, you can simply fill in your email address and join our list. I'm going to click back up to the top here. We're going to go over to conditions again, and I'm going to show you another condition. And this time we're going to choose number 13, which is proficient in reading, grade 8. Once again, this tells you the domain is education. It's number 13, proficient in reading, grade 8. I chose this one because unlike bullied at school, this one is a protective factor. And we let you know over here underneath the definition that the 8th grade achievement levels are measured under a national test that shares the score, that proficient in reading can be a protective factor, and a higher percentage is more desirable. Once again, we have the map. You can hover over. We can take a look and see Greater Sullivan at 33.8. Over here in the Seacoast, because we have complete data for this, 56.8. And the legend tells us that they range from 33.8 to 56.8. And there's that geography reference map again. Over here on the right, you can see that the statewide rate for 8th graders in New Hampshire that are proficient in reading is 45.4%. And then in this case, since a higher percentage is more desirable, we've shared the 3 regions with the lowest rates on this condition: Greater Sullivan, Greater Monadnock, and Winnipesaukee. Our data source is the New Hampshire Department of Education, and there's a link to the data set. Moving down to the so what, we once again give people an overview of why reading proficiency in the 8th grade is relative to children's health. Strong academic performance is linked to better health overall, and struggling with reading can cause stress and lower self-esteem, which can affect mental health for children. Children from low-income families often have lower reading scores due to fewer resources and less access to quality education. This condition is also associated with all 4 of those domains. And once again, there's that associations button. When you scroll down to this now what, there's a similar resource here with lead prevention, because we know that exposure in childhood to lead can impact brain development and the ability to learn. We've also included some resources here about equitable attainment for youth, from 2 different resources. One is a New Hampshire level resource and one a national level resource on the connection between equitable education funding and proficiency in reading. Okay, so we're going to pop back up here and I'm going to take you through the rest of the menu. Over here in the About menu, if you click on About the Dashboard, this gives people an overview similar to what you heard when we first started out this webinar, to let people know the purpose and the methodology and what we hope our goals for the projects are. Also in the About menu is a profile of New Hampshire children, and this is an infographic that gives everyone foundational information about children and some of their population statistics in the state of New Hampshire. Moving along with that About menu, this takes you to that page that the associations button took you to on the conditions pages, which has the outcome and behavior domains with the associated conditions. And then we included this page as well, which is overall regional ranks by health outcomes. So even though the dashboard is focused on the conditions and drivers behind the health outcomes, we know people are very interested in the health outcomes data as well. So on this page, you'll find 4 maps that are divided by those domains that show each of the public health regions ranked from best to worst performing based on the behaviors and outcomes within that domain. And then the final option underneath the About menu is acknowledgements, where we thank all of the people, and so many, so many people and organizations that shared their time and expertise while we've been developing the dashboard over the past 2 years. Now we'll move over to the Dig Deeper menu. And when you click on that, you have 3 other choices below this. So one is a link to our methodology. And this is for the people who love to get into the kind of nitty-gritty behind the analysis. And so this does talk about that. It also discusses some data limitations. Talks about our correlation analysis. And then I've even provided a table below, which actually shows you the correlation scores and how they're associated with the 16 conditions that we've highlighted in the dashboard. Also underneath the Dig Deeper, we have a data source list, and this provides the data source, the definitions, and for all of the health outcomes and behavior measures, as well as the conditions measures. And then the final thing under Dig Deeper are other resources. And here we've just shared some other data resources that people may be interested in who are interested in the children's health topic. There's a summary of each data resource and the ability to click directly to that resource. We just thought, as long as I was finding them along the way, why not share them with everyone else as well? And then under the menu, the final item is the Tell Us. And this is just a form for you to give us feedback. And we'd really love to hear from people how you're using the dashboard. And not only do we want to hear that because we are interested from an evaluation perspective, but we're really interested from a collaboration perspective. And so we are really hoping to hear from you what is interesting and valuable, so that as a foundation, we can help support you with convenings, or perhaps bringing in a national speaker on a subject, either condition or something under the now what, or just helping people collaborate and to use their resources as efficiently as possible.